So we have three different gum layers. We have ectodermal, we have mesoderm, and we have endoderm. Different layer form different set of organs, different set of tissues. Especially if you talk about ectoderm, it forms our skin, hair, nails, glands, especially mucus, salivary, and sebaceous, basically the sweat glands. Then teeth, eyes, right? So and much more. In ectodermal dysplasia, our ectoderm layer undergoes dysplastic changes, and because of that, formation and maturation of these tissues and organs will be affected. In that stage, clinically, you will find defective skins, defective hair, and defective rest of the organs. So let's just understand what is ectodermal dysplasia. See, ectodermal dysplasia, as we know, it's a group of disorders. It's just not one single disorder. It have more than 200 disorders. Collectively, they have dysplastic changes in ectoderm and depend on phenotype, or you can say depend on appearance, or you can say depend on its clinical presentation. Different set of syndromes, different set of disease are designated. So the classification is only based on clinical features, and there are more than 150, more than 200 in this article. There's more than 200 syndromes out there just for the ectodermal dysplasia. But don't worry, we don't have to remember all of them. We just have to remember two main. These are based on sweat glands. Basically, there are two kind. One is hypohidrotic. Hydrotic mean sweat. Hydrotic mean sweat. Anhydrotic basically means sweat. So in one variant, there is less amount of sweat or basically no amount of sweat. And the other variant is hydrotic, in that sweat glands are not affected. Glands are not affected. Clinically, these are most common in whites. In almost all of them, there is no gender predilection except in one, which is hypohydrotic. And in these cases, it is more common in males. Basically, it only occur in male, you can say, because female is a carrier for this pathology. So it's a X-linked recessive disease. It's X-linked, so basically it only occur in men. Right, so you can remember it this only. In ectodermal dysplasia, you see bald people because there'll be a lot of hair loss, and because of that, where you see who you have more tendency of being bald, male or female? Males. So male have more tendency of being bald, so male have more tendency of ectodermal dysplasia. Don't worry, autosomal recessive and autosomal dominant variants are also available, which are quite rare. And if they ask you which gene is most affected, ectodysplasin A gene. You have to remember just one gene only. Out of all of the 200 syndromes, just you have to remember these two. And in that, just remember ectodysplasin A gene. So the clinical feature, we have huge list for clinical features. Let's just go through each one of them. And let me tell you, it's just very simple. You just have to remember. See, hypohidrosis means decreased amount of sweat. Anomalous dentation because teeth are in ectomesodermal in origin. Our teeth are ectomesodermal in origin. So even teeth are affected. Because of that, we either have oligodontia or hypodontia, or sometimes anodontia. total absence of teeth. Onychodysplasia, nycoming nails. So there, dysplastic means basically malformed nails. Then we have hypotrichosis, basically alopecia you can say, or basically total layers of hair, absence of hair you can say, absence of hairs. That is hypotrichosis. Then there is frontal bossing because of, see, the rest of the structures are underformed and the sutures are underformed in these stages. So the because of that the other structures are underformed. You have frontal bossing. Your frontal bones, you have this big curve, and then you have your eyes and then your name. So this part is overly formed. This frontal bossing. Sunken cheeks, self-explanatory because of dysplastic skin formation. Then you have saddle nose for the similar feature, thick everted lips because of malformed of skins. Same wrinkled hypopigmented skin around the eye. So basically entire face will be deformed. You have big forehead, then you have small sunken cheeks, and then you have saddle nose, right? Depressed cheek, saddle nose, big forehead, like some, it's just like, have you seen that monster named Frankenstein? Looks something like that. Large low set of real, basically because of low amount, because of less development of skin, less development of some in the cartilage. In these cases, you have your depressed ears, extensive scaling of skin. See, all these features, frontal bossing, sunken eyes, saddle thick, all these features are present in adults. How do you diagnose ectodermal dysplasia in a child? You will look for extensive scaling of skin, unexplained pyrexia, tear flow and photophobia, which is rare but you can find them. Right, so these two, three features you will find in child or neonate. Right, and then see, in these cases, even though there is just ectodermal dysplastic feature, and these features sometimes overlays with symptoms like Down syndrome, in which intelligence is affected. This is a very big differentiator. In ectodermal dysplasia, the intelligence will be normal; it won't be retarded. Especially in oral cavity, you either anodontia or oligodontia, basically either no teeth or less amount of teeth, and both deciduous and permanent will be affected. Teeth will be truncate or cone shaped, something like that. You don't have this appearance, you have this appearance. Jaw not affected with anodontia. Even though you have less amount of teeth, that doesn't mean you have absence of jaw. You will still have your complete jaw irrespective of whether you have teeth or not. True lip if no teeth is present. It's very common, right? So if there is no teeth present, your lip become everted and become like this. This is how your lip will look like. If this is your nose, your lip will be everted and protruded. High palatal arch, cleft palate and lip may or may not present. Hypoplastic salivary gland. So basically I told you your salivary gland will be affected. This is hypohidrotic variant. So your salivary, sweat and mucus gland will be affected. Because of that, salivary secretion will be less, sweat secretion will be less, and mucus secretion will be less. And if there is low amount of salivary gland, xerostomia will follow. And there is Xerostomia, so there is basically you can say decreased salivary function, then which cause xerostomia, and xerostomia will cause caries, carious teeth. It will cause caries. So you have less amount of teeth, and even those teeth get carious over time. So sooner or later you have more chance of losing everything you have, losing all of the teeth. Because there is a xerostomia, your mucus, your salivary, and your sweat glands are diminished. You have dry, cracked lip with pseudo-ragged formation. Not just your lip, even skin will be teared away. You have sometimes the features of angular cheilitis. It may give the features of angular cheilitis, may precipitate in these stages. And because the salivary glands are not working, you will have less amount of function in pharyngeal nasal mucosa, and because of that it will cause rhinitis, dysphagia, because your oral cavity and your pharynx is dry. In this stage, if your pharynx is dry, you will have difficulty in swallowing and eating the food, and since pharynx is also affected, you will also may precipitate hoarseness of the voice. So what is the other variant? The other variant is hydrotic. Hydrotic means no sweat gland affected. Basically, sweat will be present. Not all ectodermal dysplastic disease have similar features. In some stage, some are affected, in some are not affected. So you don't have to bother about that. It is an autosomal dominant anhydrous one. It was sex-linked recessive. So basically, non-hydrotic was X-linked recessive, but hydrotic is autosomal dominant. Basically, opposite of this. Basically, opposite of this. It's very easy to remember. Homozygous state, lethal. In this state, if you have both of the genes which are affected by ectodermal dysplasia, then it is going to be very lethal. So in this state, you have nail dystrophy. Your nail will be thick and discolored. Hair defects will present, right? Palmoplantar dyskeratosis may present, increased amount of keratosis. Scalp hair will be either they'll be fine, sparse, weak, very brittle, they'll fall very easily. No clinic plus going to shave these hairs. Eyebrow, they are thin, sometimes even absent. Faces will be normal, sweating will be normal. And one more thing, there is no dental defects in hydrotic. So if you want to sum up hydrotic between non-hydrotic, hydrotic is autosomal dominant, sweating will be present, no dental problem. In this, it is X-linked recessive, sweating will be absent, and there will be dental problems. Very easy. Histologically, you just have to draw everything as normal. Just have to draw ectodermal, basically epithelial part defective. You have to also either reduce or absent the number of sweat glands, reduce or absent the hair follicles and sebaceous gland. In hypohydrotic, sweat and mucus gland and especially the ataxia of the ducts will also be present. Treatment, there is no possible treatment in this state because it's a genetic disorder. Some cosmetic changes can be done up to certain level, but there is no definite treatment for this. For dental problems, depending on the pathology, person have anodontia, a denture can be delivered, or sometimes even implants can be used depending on the severity of the pathology. This is how the people with ectodermal dysplasia. This is frontal bossing in these cases. It is not very prominent in this area, and you can see protuberance of lip, right? And these are cone shaped teeth. They'll be dry. There's a xerostomia, so sooner or later they're going to get carious. So the person might lose his teeth, these some teeth or also, right? So see how in this area just only two teeth are present, even the jaw is very simple. Also remember in this shade you can also have cleft lip and palate, right? So this is for ectodermal dysplasia. If you want this note, you can contact me on the either Instagram or my Telegram channel. Thank you very much. We'll meet again in the next lecture.